All right, so welcome to this month's monthly mini. I am Val Madsen from the Respite Care Association of Wisconsin, and I am the training and development specialist. Each month we do a monthly mini training, no more than 30 minutes. And this month we're talking about long-term care supports in Wisconsin. So today's topic is really geared towards the family caregivers and understanding information about long-term care. I'm not going to stick just to respite specifically funding, but I will for sure mention which ones do cover respite. But this is really looking at long-term care funding and supports throughout Wisconsin throughout the lifespan. So we'll talk about both the children's side and the adult side. And then we'll also spend some time going into the grant programs that RCAW has for family caregivers to fund respite care. So long-term care in Wisconsin is a very large program. Over 85,000 children and adults with disabilities and older adults use home and community-based services, such as personal care or home health care, respite, all of those things. So it's a very large support system in Wisconsin. So looking at the long-term care supports, we're going to break it down into children and adults, and then we'll go into each one. So that's really the game plan for today. Is we'll talk about the children's side, and then we'll talk about the adult side, and then we'll jump into the Respite Care Association of Wisconsin's grant programs. So we're going to start with the children's side. So the big program for people with disabilities that provides services is Children's Long-Term Support Waiver, which is CLTS, is often how it's referred to. The smaller program, Children's Community Options Program, or CCOP, is also available, but the majority of children with disabilities go through Children's Long-Term Support Programs. And this is programs run through DHS to provide services for children with disabilities. When someone applies to this program, you will work with a service coordinator to figure out what the child's needs are and the services that are to be funded. This is not an income-based program, or these are not income-based programs. There might be a cost share as part of it, but that's determined through the program. And whether you get in or not is determined by a functional screen, which the service coordinator does. So really looking at the CLTS waiver services. So this program covers things that are non-medical services. So this would be like your respite. This would be any additional supports, maybe for communication or technology, safety within the home or equipment needed, parent support, parent training for conferences, things like that. It's for children who are under the age of 22 and then are living at home. They aren't in an institution. And one thing that always trips up parents that I've worked with in the past is that need for a level of care that is at like an institution or a nursing home level of care. That just means that the child needs more assistance than what is typically typical for a child of that age. So again, there's a functional screen. You go through and answer those questions with a nurse that comes into the home to give more information about your child to figure out if you qualify for CLTS or CCOP services. Another funding stream on the child side is Katie Beckett Medicaid. So this is more the medical health side. So as I said, CLTS is the non-medical. Katie Beckett is more the medical side. And so this is for children under 19 who live at home. And again, the same types of qualifications. And it's the same process. There's a functional screen, you figure out what services, and you get a Medicaid card. It's just through a Katie Beckett process. This is also not income-based. So it doesn't have to meet certain income criteria. It really does look at the needs of that child, not of the income of the family. This is where typically like your personal care is funded. If your child's over the age of 7, it will cover briefs or depends, diapers, things like that. And I apologize for my dog. He likes to join in on my conversations. So those are two of the children's programs, and you can qualify for both, or your child might only qualify for one. DHS does a fantastic job of having some really great resources. And so there's this one up here that it's a two-sided that goes through the different children's programs and contact information. And then this, the orange handout is a really great resource that talks about what Medicaid, so your Katie Beckett funds, or what CLTS will cover, or what CCOP will cover. So each program covers different things. There's some overlap, some not. So you really work with your service coordinator once you get into these systems to try to figure out those programs. So those are the big funding sources for the children's side. So it's somewhat simple because it has really mainly those two paths. There is also something called kinship care, and this is a program to help families that have a child that's not a parent-child relationship. So it's with a relative. So this could be an aunt or an uncle or a grandparent. Somehow another family member, a relative, is temporarily or permanently having custody or supporting the child or taking care of the child. There is some funds, monthly funds for individuals in the situation to receive some additional support. So that's under kinship care. And under kinship care, there's also opportunities to apply for CLTS if the child has a disability. Kinship care doesn't necessarily just qualify kids with disabilities. It could be for anyone that is supporting a child that's not their direct child. So again, a relative. So the child doesn't have to have disabilities in order to qualify for kinship care. But we do want to let you know about that funding source as well. So really, who do you contact? So for each program, there are different contacts. I will put a link in the chat in order to have access to this. And we do have this information on our website as well. But for CLTS, CCOP, you go through county waiver agencies. And what that means is each county has an agency that's responsible for those funds. So you have to go to your specific county. So there's not just one number. So you have to look on the DHS website, look for the county waiver agency in your area. Kinship care, kind of set up similar. Each different part of the state has different contacts. So again, there's a link to the map to get to the kinship care coordinators. Both of those you can easily find by searching, kinship care in Wisconsin or CLTS in Wisconsin, and you'll be able to get to that information. For Katie Beckett, there is a number to call, and so that's where you would start. So on the children's side, you have to reach out and kind of do those different steps in order to find the correct long-term care support program. But again, the website does a really good job giving you lots of information. So I definitely encourage you to look there or to start there. Okay, so now we're going to switch to the adult side. So with adults, it's a little more complicated, or there's more options or different paths you can take. So really looking at the adult side, we're looking, family care, IRIS, PACE, NFCSP, or AFCSP, and we'll talk about each of these. So let's start with family care. So this is a long-term care program for older adults and adults with disabilities. Again, the goal of most of the Medicaid programs are to keep the individual in their home and not into special institutionalized or hospital type care. So these are pretty much all services are under one program. So the person would have to have a disability, or they're older, or have a lasting chronic illness. Again, there's a functional screen that you would go through. So there's two main partners under family care, is the Aging and Disability Resource Center. And we'll talk more about these a little bit later, but these are centers that serve the public, and have information. They don't sell anything. They aren't a program themselves. They are just there to give you information. So in order to get into family care, you go through an Aging and Disability Resource Center, or an ADRC. The other side of family care is managed care organizations. And again, different parts of the state have different managed care organizations, or MCOs. The MCO is what figures out the program side of your services. So when you are enrolled with family care, you are able to request services through your MCO, and you create a plan. And the MCO is the one that manages the care that you receive. Another program is the IRIS. IRIS stands for Include, Respect, I Self-Direct. It's, again, a program for adults and with disabilities and older individuals. It's a self-directed program, so it's different than family care, where you're not going through a managed care organization that's going to help you find services and they pick who you use for services. IRIS is more self-directed, so that you're able to have services in a variety of different ways. They create a budget. You work on the budget with them, but you manage your services. You figure out who you're going to use. So because of that, there's a lot more partners on the IRIS side. So obviously you still have the Aging and Disability Resource Centers, which we talked about is that information center. They're going to be your key contact as you go. There's also IRIS consultant agencies, which is ICAs, and they help manage the care. So they might help or handle the day-to-day operations. You could choose an IRIS consultant that will work closely with you and make sure that you have all the services you need. There's also fiscal employer agents, or FEAs, and they are the ones that help because you are the ones managing your care. They're going to help with like background checks or payroll, taxes, and help with the payments going out. There's also something called an IRIS self-directed personal care oversight agency, which would look specifically at personal care instead of going through another organization through Medicaid directly. You can go through this agency, and then Metastar, which is more on the grievance and complaint side. So IRIS has a few more partners than what you see with family care, because again, it's more self-directed. You are going to work with a variety of people. Then there's also a program called PACE, which is a national program. It's a program of all-inclusive care for the elderly. This is only available in 4 counties in Wisconsin. So Kenosha, Milwaukee, Racine, and Waukesha. So I'm not going to go in depth into it because it is just a small part of the state. But again, the DHS provides a lot of really good information, and I'll give you links to that information as well. But this is another program that can help with older adults looking at, your healthcare, long-term care support, and prescriptions. 2 more additional programs is NFCSP, which is the National Family Caregiver Support Program. And this is to give supports to help family members, or caregivers care for older adults. So this could be available to anyone who's providing care to an adult over 60. So this program really is for the caregiver, not for the individual, where everything else we've talked about so far is about direct funding for the individual. And then the Wisconsin Alzheimer's Family and Caregiver Support Program, which is the AFCSP, is like the NFCSP, just serves individuals with Alzheimer's. But again, this is specifically for the caregiver, and it doesn't have to be someone living with someone, just someone who's an informal caregiver supporting anyone either with Alzheimer's or over the age of 60. These programs can provide a small amount of funds, but they also do a lot of training and support groups, things like that. But it's not long-term care support for the individual. It really is looking at supporting the caregiver. Okay, so with all of these adult programs, you go to the ADRC. So they make it super simple for the adult side. you contact your ADRC, and some counties have just one ADRC for their entire county. Other counties are within a region, especially when you get to northern Wisconsin, there might be 3, 4, 5 counties within one ADRC. So what you do is look up your county or your city and figure out which ADRC you use and contact them. They will work with you to go through a functional screen, or work with the individual to go through that functional screen and let you know your options. You know, they'll give you information about family care and about IRIS and PACE if you're in one of those, you know, Milwaukee area county, you know, Racine, Kenosha, that area. We'll let you know about NFCSP and AFCSP. If you are working with someone with dementia, working with a dementia specialist in your area. So there's a lot of different options, and there's one contact, which makes it super simple. So again, you would reach out to your ADRC if you are on the adult side. Okay, so a question came in the chat. Are there organizations like NFCSP that provide support for caregivers taking care of family members under the age of 60? Yes and no, not specifically outlined, but in Wisconsin, there is a caregiver group, and I will definitely get that information and make sure to put that in the chat and find that for you. There is also Respite Care Association, which really focuses on, which is what we do, focusing on supporting the caregivers. And each county also has some programs as well. So really the ADRCs have a lot of really good information because this isn't just necessarily older adults. The ADRCs help anyone with a disability, but they do much more focus on the adult side, you know, 18 and up. And they might have some information specifically for your county as far as caregiver supports. I know a lot of communities have smaller county run caregiver support groups or funds. You know, some areas do that really well. So making sure that you reach out to your ADRC would probably be your best option, but I will make sure to get the caregiver, the state of Wisconsin caregiver group as well. So some additional handouts on the adult side. There's a really great handout that talks about IRIS, family care, PACE, all of those and what services you can ask for. The map that had all the ADRCs, and then an ADRC brochure that talks about ADRCs in general. And I will make sure that I will link those all in the chat as well. And those are also on our website and will be on our YouTube channel under this video. So kind of nutshelling it, looking at long-term support contact lists. There's the 3 for the children's side and then the 1 for the adult side, which really is the ADRCs. I will be sharing this PowerPoint. It will be in the comments or the description under the YouTube video, and it will also be on our website, and I'll show you that page as well. So you will have access to all of this information if you need it. So that is really where you start. So depending on the, you know, again, children or adult, older adult, that is where you go. That is how you get started with long-term care. Respite Care Association of Wisconsin does have some grant programs, and specifically for caregivers. So the Caregiver Respite Grant Program or the Supplemental Respite Grant Program. We also have some other grant programs for agencies, but this really is looking more at the family caregiver side. And why we added this into this PowerPoint is these grants, you do need to have access or be using or have used all your funds or something in the long-term care support process. So this is grants to use after your funds have run out, or if you are not eligible for funds for whatever reason, but you do have to have applied to the long-term care support programs. So the Caregiver Respite Grant Program provides support for a family caregiver for up to 5 days of respite within a 30-day period. You pick who you want, you pick the amount, you pick if that up to 5 days is, one afternoon, one weekend, a couple hours, the entire, 5 days, 24 hours a day, you pick what you want to do that with that. Within 30-day period means when you apply for it, you have to use it within or have those services within the 30 days. So again, it's your choice. It's very flexible. We didn't want to create another barrier or limits on who you could hire, who you can't hire. If it's a family member, whatever it looks like, this is to be here to support whatever needs you have. You pick the funds, you pick the amount, you pick the provider. Some individuals have used it for like a overnight stay, like at an institutionalized type care or a CBRF or something like that. Others have found someone independently to come into their home and stay there. So again, this is to use after other long-term care waiver programs have been used up or aren't available or you're not eligible for, again, to be there as kind of your fallback. You can reapply for this every 90 days. Our other respite grant is our supplemental respite grant program, which is our SRGP. And this is very unique. It is looking at giving primary caregivers $250 for supplemental respite services. So this allows you to hire someone of your choice to help with housekeeping, meal prep, laundry, lawn care, snow removal, transportation, technology, things like that. We realize that you have, as a family caregiver, you have many hats that you wear. You aren't just caring for the person you're taking care of. And sometimes having that extra help is just as much respite as you having a break from that individual. And if you are able to have someone in to come deep clean once every 3 months, that might be the best way to support your caregiving situation. And so we recognize that as well. So this is something you can apply for every 90 days. It's a $250 stipend. Again, however you want to use that, and whoever you're as towards these services. How if you want to hire a family member or a community member, or however that is used for some of these things. Maybe it's, we're coming into winter here in Wisconsin. So maybe it's snow removal, and just having someone assist with that or shopping or things like that might be a huge benefit and a form of respite that's not really seen as respite in the non-traditional sense. So looking at the questions, so these are our 2 caregiver grants. So really the caregiver respite grant is really looking at finding someone to care for the person. So that might involve personal care. So that could be, bathing, dressing, eating, feeding, things like that. But that might not be what your individual needs, the care recipient that you care for. Maybe it's more so that companionship care, or maybe it's to have someone take them into the community. Whatever respite looks like for you. Here at RCAW, we really believe respite is an outcome and not necessarily a service. So it could look differently for each person. So whatever gives you respite. But this is that one-on-one care for the individual you're caring for, where this is really looking at the supplemental, looking at ways to help out and ways to help clear up some time. So again, another way to look at respite as well. All right, so information about our grant programs is on our website. So under our grant tab, so respitecarewi.org is our website, and then under grants. Otherwise, we have an info at respitecarewi.org. That's our general email or our phone number. A lot of this information is on our website, so do please feel free to check it out there. But if you have questions, you're more than welcome to reach out to us. I am going to put in the chat the direct link to our training course, and then also the contact list for long-term care supports. And then here's my information. But we are going to hop over to our website so that I can show you. Okay, so when you're on our website, if you go to training, there will be something called monthly minis. And on the monthly mini tab, if you scroll down, there's an archive of past monthly minis. So once I get this video uploaded, it will be right here. So you can come back and watch this video at any point in time. But then there's a bunch of handouts. So the PowerPoint, the contact information, and all of those other things that I had mentioned as handouts in this presentation, all of that is right here. If you look at under our programs, the grants, this is where you're going to find information on how to apply for our two caregiver respite grant program and the supplemental respite grant program. So those two are at the very top so that you have access to them right here so that you can easily get in and apply. Again, we don't want it to be more paperwork. We just do need some paperwork to track the funding, but it should be a pretty simple process. But we wanted to share information about long-term care supports along with the respite care grant programs. Any other additional questions people have? Otherwise, all these links will be in the comment section below this YouTube video. So feel free to check that out.